For the posterior glide, yep. So it's going to feel like you want to have the table up high. If you're going to make a mistake, that's probably going to be the mistake. Table needs to be low because you want a straight arm, straight lines, right? So resting position, you're going to angle the person so that they're like this now, right? And so she's kind of at a diagonal so that now the table, I could put a sandbag or a wedge there, but the table is hard enough to block her. So I don't have to worry about stabilizing her shoulder blade or her scapula. So here's her scapula, here's the glenoid here. I need to be able to make sure the humerus can clear the table. And so I'm gonna be in this position. So again, so now resting position, her arm can rest on my leg as well. I got her close to me so she feels comfortable. Straight arm. We want to make sure we're on her humerus, perpendicular to the floor. Slight traction, and then a little squat, posterior glide. You don't need to do much, right? So remember, in this position, what grade is this? 1. It's already a 1. As soon as I push and I feel it come back, that's a grade 2. Traction, I get to the end. Right there, that's grade 3, that's stretch. 5 to 10 second hold, at least 8 times. And then we recheck what motion. Now that's a question. So if I'm doing this technique, I'm doing it 8 minutes total, I'm gonna retest flexion. You're gonna do a goniometry measurement of flexion. Now, is it active or passive? What motion are you gonna be measuring? Active or passive? Nope. Passive. Because you're stretching, right? You're stretching. When would you measure active? So what kind of activity would you do? Well, you could measure active, but you're stretching. So the stretching this is measuring how well your stretch actually occurred. So when am I going to do an active goni measurement? When do you think I would do that?
Like if it was shoulder between like wall walks or something.
So if it's neuromuscular rehab and I want to see that she gains some active range of motion, which would be strength, right? More than likely it would follow a technique that we did for pain relief, right? So we did something for pain relief. It was resisted motion caused pain. And now we did our technique. And now we're measuring active range of motion because we decreased active pain. Does that make sense? That's different than passive. Good test question too, right? So this, I'm measuring passively how much motion I got.